Good afternoon, and welcome to my Friday message. I'll start with COVID update and then share some important news with you. Regarding COVID in our community, the good news is the case numbers have declined across North Carolina and in Durham after the expected post-holiday surge. The CDC currently places Durham County at a medium community risk level, and there are currently 127 people hospitalized with COVID in the university hospitals, with a testing rate showing about 13% positivity. The improving numbers should encourage us to redouble our efforts to keep the trend lines moving in the right direction. You can help reduce the risk of transmission of COVID and other seasonal respiratory illnesses by taking the appropriate precautions. If you have active symptoms of COVID or other respiratory illnesses, please stay home. And if you test positive with a home antigen test, please report your results to a Duke's Employee Occupational Health and Wellness Office, so we can identify possible clusters and take appropriate steps to control any transmission. And please remember that home antigen tests can show false negative results the first few days of illness. And if you want a PCR test, they are available through SimMon app or the COVID hotline at 919-385-0429. So first, some news I'd like to share regarding the U.S. News and World Report rankings. By now, you've heard that the School of Medicine has chosen to withdraw our annual U.S. News and World Report rankings of medical schools and will no longer report our data to U.S. News for that purpose. These rankings have been a prominent feature of the academic landscape for a long time, and we have not taken this step lightly. But I, along with many of my colleagues at other leading medical and professional schools, have had significant reservations about the methodology, the validity, and the value of these rankings for a long time. The rankings, as they stand now, are based on a limited, incomplete, and somewhat capricious set of metrics, including standardized test scores, acceptance rates, and federal research funding. They measure some things, but they don't measure what I and many others consider the most important factors for any prospective student trying to determine which school might be right for them, which is the purported purpose of these rankings. In fact, they can lead to perverse incentives for data reporting and have an inappropriate influence on policies and decision-making. What the rankings don't reflect are our core values, the character and quality of our medical education programs, or the innovation and impact of our research. The School of Medicine is a vibrant, diverse community characterized by a culture of collaboration, a dedication to scientific discovery, and a spirit of service. It's a place that has made proactive commitment to equity, diversity, and inclusion. We seek every day to improve and to make sure that every member of our community feels valued and respected. Our faculty, staff, students are driven by curiosity, compassion, and a drive to improve health and make the world a better place. That's what makes Duke so special. Our students tell us that as well in their surveys as they're entering the next phase of their career. You won't find any of that in the current rankings. We are committed to transparency, and our admissions office makes publicly available information freely to prospective students in the broader community. And we will continue to seek ways to improve access and accountability to meet that need. The other news I'd like to report today are the presidential awards. I want to congratulate 3 individuals and 2 teams in the School of Medicine who last week were named winners of the 22-23 presidential awards. Winners include Joseph Turek, a remarkable surgeon who has been at the heart of several extraordinary breakthrough procedures in recent years. John Precautions, an assistant professor of emergency medicine, who has devoted himself to ensuring that emergency medicine patients receive care that goes beyond the moment of crisis. And Sheba Hall, an administrative coordinator who has been the glue that holds the Office of Student Affairs together for more than 30 years. The Duke Regional Hospital tracheostomy team, which developed innovations that considerably reduce readmission and mortality rates, and the Thymus Transplant Regulatory Affairs and Quality team, which played a critical role in helping to move a life-saving therapy for children born with congenital athymia from lab to clinic. The presidential awards are the highest staff and faculty awards the university presents, and I'm incredibly proud of this year's winners. And lastly, the Dean's Distinguished Research Series. I want to remind you that we have expanded our former Research Week into an exciting new series of lectures featuring groundbreaking research in basic clinical and translational sciences at the School of Medicine. The Dean's Distinguished Research Series will begin on February 23rd with a special event featuring the annual Robert J. Lefkowitz Distinguished Lecture by Titia DeLange, Director of the Anderson Center for Cancer Research and Head of Laboratory Cell Biology and Genetics at Rockefeller University, as well as the faculty lectures by Deborah Silver and Craig Lowe. The series will continue on March 9th with faculty lectures from Chris Breyer and Keisha Bentley Edwards, and on March 30th with faculty lectures by Shyla Erglu and Andrew West, and will conclude with lectures by Kimberly Johnson and Lisa McElroy. The March events will also feature trainee poster session, and all events will be held in the Trans-Siemens Center. Thanks all of you for joining me today. Stay safe and have a great weekend.